Can a blood test detect cancer before symptoms? Liquid biopsy explained. Imagine finding cancer through a simple blood sample, perhaps even before a person notices any clear warning signs. Could this really be possible? Detecting cancer early matters because smaller, localized cancers may offer more treatment options than cancers discovered after they have already spread. A liquid biopsy is a test that searches blood or another body fluid for microscopic material released by cancer cells into the body. Unlike a traditional tissue biopsy, it may not require doctors to remove a piece of the tumor using a needle or surgical procedure. Our blood contains countless microscopic clues, including proteins, normal cell fragments, genetic material, and occasionally material released by a developing tumor. As cancer cells grow and die, some may release tiny pieces of genetic material into the bloodstream, where sensitive tests can search for them. This tumor-related genetic material is called circulating tumor DNA, usually shortened to ctDNA. It represents only a small portion of DNA in blood. Some liquid biopsies may also examine intact circulating tumor cells, proteins, RNA, or small particles released from cells called extracellular vesicles. The process begins with an ordinary blood draw. The sample is collected in a tube and carefully prepared for detailed laboratory examination. Scientists separate the plasma, the liquid portion of blood, from blood cells, then extract the tiny fragments of cell-free DNA present within it. Advanced sequencing technology can examine millions of DNA fragments and search for mutations, rearrangements, or other patterns associated with a tumor. Some tests also study epigenetic signals, such as DNA methylation patterns, which may reveal how genes are being controlled inside abnormal cells. Computer systems then compare the detected patterns with large medical data sets to determine whether a suspicious cancer-related signal may be present. In some cases, these patterns may also provide clues about the organ or tissue where the abnormal signal could have originated. This creates an exciting possibility, detecting a cancer-related signal before a tumor becomes large enough to cause noticeable symptoms. However, finding a signal is not the same as confirming cancer. Abnormal results generally require imaging, examination, or a tissue biopsy for diagnosis. Traditional tissue biopsy remains extremely important because it allows specialists to directly examine tumor cells and confirm the cancer type under a microscope. Liquid biopsy has an advantage because blood collection is usually less invasive and may be easier to repeat at different points during treatment. Repeated blood tests can help doctors observe how the amount of tumor DNA changes while a patient receives treatment. When the level of circulating tumor DNA falls, it may suggest that treatment is working, although results must be interpreted with other medical evidence. If tumor-related DNA begins rising again, it may provide an early warning that cancer is becoming active or developing resistance to treatment. Researchers are also studying liquid biopsy for minimal residual disease, tiny amounts of cancer that may remain after surgery or other treatment. These remaining cells may be too small to appear on a scan, but in some situations, their genetic traces may still enter the blood. Liquid biopsy is already used in selected patients with advanced cancers to identify mutations that may guide certain targeted treatments. For example, some approved tests can analyze blood from patients with cancers such as lung, breast, prostate, colorectal, or ovarian cancer. But the usefulness of the test depends on the cancer, its stage, the amount of tumor material released, and the specific test being used. Large or advanced tumors may release more detectable DNA, while very small, early-stage tumors may release only an extremely tiny amount. This creates one major limitation. A negative result does not always prove that cancer is absent. The signal may simply be below detection. False positive signals are another concern. A blood test may detect an unusual change even though later diagnostic testing does not find cancer. Some age-related blood cell mutations can also appear in cell-free DNA. potentially creating signals that must be carefully separated from tumor DNA. For these reasons, experimental multi-cancer blood tests should not automatically replace established screening methods recommended for breast, cervical, colorectal, or lung cancer. Scientists are conducting large studies to determine whether multi-cancer detection tests truly find cancer earlier and, most importantly, whether they reduce cancer deaths. In precision medicine, liquid biopsy may help doctors understand the genetic features of a patient's cancer and choose more individualized treatment options. Future tests may combine DNA, proteins, immune signals, advanced sequencing, and artificial intelligence to improve sensitivity while reducing inaccurate results. Liquid biopsy is a powerful and rapidly developing technology, but it is not yet a universal blood test that can reliably detect every cancer. Its greatest promise may be helping doctors find hidden cancer signals, monitor treatment, detect remaining disease, and personalize care with less invasive testing. This video is for education only. Never use a blood test result to diagnose yourself. Discuss cancer screening, symptoms, and test choices with a qualified doctor. For more easy-to-understand 3D medical explanations about cancer detection, prevention, and treatment, subscribe to the channel and stay informed.